Hello, everyone. I am Dr. Christina Morgan. I want to begin by saying this very clearly. Self-pleasure has no age limit. Sexuality is not something we retire from. It's an essential part of our emotional, physical, and even cognitive well-being. After 60, touching your own body is not only acceptable, it can be profoundly healing. But just like anything in our changing bodies, it deserves awareness, safety, and kindness. Today, I want to talk about how to masturbate safely after 60, and especially how to avoid 3 dangerous mistakes that too many people never talk about. As we enter our 60s and beyond, our bodies begin to speak to us differently. The rhythms we once trusted without question, heart rate, breath, endurance, even arousal, now ask to be acknowledged with greater tenderness and awareness. When it comes to self-pleasure, many people believe that because masturbation is private and familiar, it requires no preparation or caution. But this is where quiet dangers can hide. What was effortless at 40 can feel unexpectedly strenuous at 70. And one of the most overlooked risks is rooted in something many of us already manage daily: blood pressure and heart health. So much of our conditioning has taught us to associate sexuality with urgency, clenching, holding the breath, striving for release. That pattern, often carried unconsciously into later years, can place sudden pressure on the cardiovascular system. During arousal, the heart naturally works harder, vessels dilate, and blood flow increases in the genitals. For a younger body, this is easy to carry. But for someone living with hypertension, a heart condition, or even mild arrhythmia, what feels like simple pleasure can trigger unexpected symptoms: dizziness, flushing, chest warmth, or a sensation of pounding in the ears. These are signals, not of danger, but of the body's request to slow down. Many individuals over 60 have been prescribed medications such as beta blockers, blood thinners, or ACE inhibitors. These medicines do not forbid pleasure, but they do change how the body responds to exertion. Holding one's breath during climax, tightening muscles aggressively, or forcing orgasm can cause a rapid spike in blood pressure, a spike that the body no longer regulates as smoothly. It is not uncommon for someone to feel momentarily lightheaded after climax and dismiss it. But repeated strain, especially in isolation, can accumulate into physical stress. The most important shift is this: masturbation after 60 must move from performance to presence. This is not about losing passion. It's about reclaiming control. Begin with breath. Instead of racing toward sensation, pause and inhale deeply before you even touch the body. A slow, full breath communicates safety to the cardiovascular system. As arousal builds, continue breathing. You are teaching the body that pleasure is not an emergency. It is a conversation. If you notice yourself clenching, holding, bracing, soften. Let the jaw release, unclench the stomach. A relaxed body supports a stable heartbeat. Some people worry, what if I become too cautious? Won't that dull the excitement? The truth is that pleasure deepens in relaxation, not speed. When you are not fighting your body, you feel more of it. Gentle excitement can be far more profound than forced intensity. Think of arousal like a wave. You don't chase it, you float on it. Allow it to lift you without strain. If you feel your pulse becoming too strong, simply pause. Lay a hand over your heart. Breathe. When your body steadies, you may continue. Another physical factor often overlooked is hydration. Yes, even this matters. Dehydration thickens the blood slightly, makes the heart work harder, and increases the chance of headaches or fatigue after orgasm. A glass of water before intimacy, even with yourself, can make a subtle but real difference. Consider this a small ritual, drinking water as an act of preparing the body for pleasure. For those with diagnosed cardiac conditions, I encourage an honest conversation with a healthcare provider. Say the words, "I am sexually active, I masturbate. Is there anything I should know about my heart and exertion?" The courage to ask this protects your freedom, not restricts it. A physician may advise simple precautions: avoid extreme breath holding, take breaks, avoid climax positions that compress the chest or strain neck vessels. This is not fear. This is mastery. Many older adults also experience anxiety during arousal, mistaking normal autonomic responses, flushing, heart flutter, warmth in the chest, for signs of danger. The mind, when unprepared, can interpret pleasure as panic. Mindful touch restores trust. Speak internally. This is warmth. This is energy. I am safe. I am here. By remaining present with sensation, you retrain the nervous system to understand pleasure as calm, not chaos. It's also important to release shame around using physical support. If you tire easily, recline. If your back aches, use pillows. If you become breathless, stop. Rest. Pleasure is not a test of stamina. After 60, sensuality becomes artisanal, slow-crafted, consciously paced. This is not lesser, it is deeper. Let us also speak of timing. Many older adults find nighttime arousal more taxing because the body is already fatigued. Experiment with morning or midday self-pleasure when blood pressure is more regulated and energy is stable. Listen to your rhythms. Your body knows the safest hours. Some people ask, can orgasm trigger a cardiac event? It is rare, but possible, particularly when stress, fear, breath holding, or sudden positional changes are involved. But understand this, it is not orgasm that harms, it is strain. Orgasm itself is a release, a softening of tension. If you approach climax with fluidity, breath, acceptance, you are aligned with nature. The body welcomes release like a sigh. In fact, regular, mindful sexual activity, even solo, can improve vascular health by releasing hormones like oxytocin and endorphins that reduce cortisol and stabilize blood pressure. Safe arousal is not a risk. It is medicine. The danger lies only in neglecting what your aging heart needs: gentleness. So, when you pleasure yourself in these years, imagine your heartbeat as a companion. Not something to overpower, but something to accompany. Place one hand on your chest, one on your body. Feel the pulse. Feel the warmth below. Let them speak to each other. You are not chasing climax. You are escorting yourself there. You are not the person you were at 20, 30, or 40. You are wiser. You are weathered. You are layered with stories. Your pleasure now carries gravity, history, depth. Treat it with ceremony, slow touch, deep breath, open presence. Let pleasure strengthen you, never deplete you. Masturbation after 60 is not dangerous when approached with interoceptive awareness, the intimate listening within. In that awareness, there is no rush, no fear, no strain. There is only the truth of this moment. I am alive. I am deserving. I am safe in my own hands. As we grow older, the language of our body changes. We no longer experience sensation in the sharp, fast ways we once did. Touch becomes slower, subtler, sometimes quieter. Yet many people over 60 approach self-pleasure with the same expectations they held decades ago, chasing intensity, performance, or release, rather than presence, sensation, and inner listening. This creates the most overlooked danger of all: disconnection, not from someone else, but from oneself. When we disconnect during self-pleasure, we slip into automation. The hands move, but we do not feel. The mind races, but we do not notice the body. We push for climax, but we abandon the subtle stories whispered through nerves, breath, and heartbeat. This separation might seem harmless, but it carries risks: overstimulation, numbness, strain, emotional emptiness, even injury. After 60, true safety lies not only in protecting the skin or heart, but in honoring the nervous system through awareness, interoception, the gentle art of feeling from the inside out. Pleasure without presence becomes mechanical, and the mature body does not respond to mechanics, it responds to meaning. This is why so many older adults report feeling numb or disconnected, not because their bodies are incapable of pleasure, but because they've forgotten how to listen. Before any act of physical touch, begin with arrival. Place one hand over your heart, the other over your lower belly. Breathe. Ask silently, how do I feel today? What is my body asking of me? Not what do I want from it? This question changes everything. It turns masturbation from an extraction of sensation into a communion. The goal is not stimulation, it is reconnection. Many people over 60 carry old beliefs about sexuality, that pleasure must be earned, that climax is the destination, that desire is a sign of youth. These beliefs cause us to rush, to judge, to compare, but your body today is not a memory. It is a living landscape, constantly shifting. When you touch yourself while disconnected, you risk bypassing signals of tenderness, dryness, or discomfort that your body is trying to express. These signals, if ignored, can turn into pain or emotional disquiet. True interoceptive pleasure is slow. It begins before arousal. It might begin in the chest, with a sigh, or in the spine, with a subtle warmth. Allow the body to speak first. Instead of going straight to the genitals, explore other landscapes, the inner arm, the neck, the abdomen. Mature bodies often need more time to awaken, but once awakened, they reveal deeper textures of sensation that youth often rushes past. Do not confuse lack of immediate arousal with loss of desire. Desire simply moves differently now. It deepens rather than spikes. It lingers rather than erupts. When we give it space, it shows us new pathways, waves rather than sparks, warmth rather than heat. Touch yourself with curiosity, not memory. Ask, what feels alive here today? The danger of disconnection is not only physical, it is emotional. Some people confess feeling sadness or disappointment after masturbation, a heaviness they cannot name. This is not shame, it is abandonment. They rushed through the act, seeking relief, and left themselves behind. But when you remain present, pleasure becomes nourishing, not depleting. There is no crash after climax, only softness. To stay connected, keep breathing. Breath is the bridge between awareness and sensation. If during arousal you notice yourself holding your breath, gently inhale. Feel your ribs expand. If your mind drifts toward fantasy that pulls you out of your body, gently return, not to judgment, but to feeling, warmth, pressure, tingling, vibration. Loving awareness, not mental escape, is what matures pleasure. For many, numbness is a real concern. Years of fast, harsh friction, especially with toys or aggressive patterns, can overstimulate nerve endings, causing temporary desensitization. Some respond by increasing pressure, intensity, or speed. This is a dangerous loop. Instead, do the opposite. Soften, stop, wait. Allow sensation to return on its own terms. Touch less, feel more. This cultivates presence rather than performance. Emotional connection to self is vital. You are not using your body, you are engaging with it. Speak gently. Thank you. Touch your body as if it belongs to someone you cherish. The body hears this. Muscles soften, breath deepens, arousal flows. Even after climax, stay present. Do not rush to distraction or cleanup. Rest your hand on your heart again. Feel what remains, a buzz, a quiet, a glow. This closing ritual seals the experience, telling your nervous system, I did not abandon you. I stayed. Self-pleasure after 60 is less about fantasy and more about relationship. Relationship with scars, with sagging skin, with softer erections, with slower lubrication. But these are not flaws. They are invitations. Each change in the body invites a change in how we listen. Youth seeks intensity. Maturity seeks intimacy. Intimacy with self is the deepest form of autonomy. When people say, I don't feel much anymore, I often respond, perhaps you are touching too fast to feel. Slow touch reawakens sensation. Intermittent stillness amplifies it. Try this. Touch, pause, wait. Let the body echo. Sensation often arrives on delay, Pleasure is not lost with age. It is relocated. You must go inward to find it. You must feel rather than force. In this season of life, masturbation is no longer an act of release. It is an act of return. A return to the body that has carried you through joy and grief, youth and change. By staying present, you are not just seeking pleasure, you are offering gratitude. This is how we avoid the greatest danger, forgetting ourselves. Pleasure without presence is empty. Pleasure with awareness becomes healing. When you pleasure yourself with full presence, you are not alone. You are with the deepest part of you, the listening part, the feeling part, the living part. That part is still here, waiting to be touched with reverence. You deserve not just climax, but connection, not just sensation, but sanctuary. In your own hands, let your body learn this truth. I am still here. I am still worthy. I feel myself fully.